Hello there and welcome. I'm so glad you've joined us today because we're going to talk about something incredibly important, something that touches the lives of so many of us, especially as we treasure our golden years. Did you know that every few seconds, someone, somewhere in the world, begins a journey with dementia? It's a staggering thought, isn't it? And what's even more sobering is that dementia is climbing the ranks as a leading cause of why we lose our loved ones too soon. Now, we often hear about age and family history playing a role in our brain health, and they certainly do. But what if I told you that some of the very medications you might be taking right now, perhaps prescribed by a doctor with the best intentions, could be silently, and I mean quietly, working against your brain? Startling new insights are suggesting that common medicines, yes, those pills sitting in your bathroom cabinet, might be contributing to memory struggles, that frustrating brain fog, and even potentially paving the way for more serious conditions like Alzheimer's, especially for those of us over 60. The most unsettling part, you could be taking these medications every single day, believing you're doing something good for your health, all the while unaware of the potential toll they might be taking on your precious memories and cognitive sharpness. It's a chilling thought, isn't it? Today, we're going to pull back the curtain on 9 common medications that research now links to a quicker onset of symptoms we often associate with dementia. And please, I urge you to stay with me until the very end. Why? Because the medication we'll discuss last is one of the most frequently prescribed, yet so few realize the profound impact it can have. But we won't just leave you with worries. Oh no, that's not our style. Afterwards, we'll explore 3 wonderful, natural nutrients that science suggests can act as a shield for your brain, helping you preserve that clarity and vitality. Before we dive in, I'd love to know where you're watching from today. Drop a comment below and tell us. It's always wonderful to see our community, and if you find this information valuable, please give this video a thumbs up and subscribe for more insights to help you live your healthiest life. Ready? Let's get started. First on our list, at number 9, are those first-generation antihistamines. Think of medications like diphenhydramine, often found in products like Benadryl. So many of us reach for these for allergies, a common cold, or even when sleep feels elusive. They seem harmless enough, available right over the counter, right? But here's the catch. These medications belong to a class called anticholinergics. Now that's a bit of a mouthful, but what it means is they can interfere with a crucial chemical messenger in your brain called acetylcholine. Imagine acetylcholine as the brain's diligent postman, delivering vital messages that help with memory and learning. When this messenger service is disrupted, what happens? You might start experiencing that nagging brain fog, find yourself forgetting names or appointments more often, and over time, this could even contribute to what we call brain atrophy, a shrinking of the brain tissue. A study published in a prominent medical journal, JAMA Internal Medicine, found that seniors taking strong anticholinergics daily for just 3 years had a 54% higher risk of developing dementia. What's truly frightening is how subtly this can begin. Maybe you misplace your keys more often, or an important date slips your mind. You chalk it up to just having a senior moment. But what if it's more? What if that slight forgetfulness is an early whisper of something more serious brewing beneath the surface, potentially fueled by a medication you thought was safe? Because they're easy to get, many believe these antihistamines are without risk. But for an aging brain, the long-term story might be very different. Is that allergy pill truly just helping your sniffles? Or could it be dimming your cognitive spark? Next, at number 8, we have benzodiazepines. If you've ever struggled with anxiety, found it hard to quiet your mind for sleep, or dealt with muscle spasms, your doctor might have prescribed a medication from this group. Names like Xanax, Ativan, or Valium. These medications can, indeed, bring quick relief. They work by enhancing the effects of a neurotransmitter called GABA, which essentially tells your brain to slow down, creating a calming effect. It's like putting the brakes on an overactive mind. But here's the question: does your brain really want to be constantly slowed down over long periods? The truth is, long-term use of these medications has been linked to some concerning changes: memory difficulties, a persistent feeling of disorientation, and even structural alterations within the brain itself. Think about that. A study in the BMJ revealed that individuals using benzodiazepines for longer than 3 months had a staggering 51% increased risk of developing Alzheimer's disease. What's particularly worrisome is how often seniors are prescribed these for sleep and then continue taking them for years, completely unaware of the potential silent erosion of their brain health. You might notice yourself feeling more tired during the day, your reactions aren't as quick as they used to be, or you struggle to keep up with conversations. Are these just signs of getting older, or could they be your brain signaling that something isn't quite right, possibly related to that little pill you take to help you rest? It's a critical question to ask, isn't it? Coming in at number 7 are proton pump inhibitors, or PPIs. Millions of older adults rely on these. Medications like esomeprazole, pantoprazole, and omeprazole to manage uncomfortable heartburn, acid reflux, or GERD. They work by reducing stomach acid, and for many, they bring welcome relief from digestive distress. But what if, while soothing your stomach, these medications are quietly creating a less-than-ideal environment for your brain? Several studies have begun to draw a line connecting PPIs to cognitive decline and an increased risk of dementia. How so? Well, by blocking stomach acid, they might also hinder your body's ability to absorb vital nutrients, especially vitamin B12 and magnesium. Both of these are absolutely critical for healthy brain function. Low B12 levels, for instance, can lead to confusion, memory loss, and even nerve damage. It's like trying to run a high-performance car on low-grade fuel. Eventually, performance suffers. A significant German study looking at over 73,000 seniors found that regular users of PPIs had a 44% higher risk of dementia. Many seniors take these medications for years, often without ever questioning if they still need them, never realizing they might be inadvertently starving their brains of essential building blocks. Have you noticed your thinking feels a bit slower? Or you're more muddled after meals, and you also happen to take a PPI? Could that little tablet you take before eating be part of the problem? It's a connection worth considering. At number 6, we find antipsychotics. These are powerful medications, including drugs like quetiapine, olanzapine, and risperidone. They are often prescribed for serious conditions like schizophrenia or bipolar disorder, but sometimes they're also used to manage challenging behavioral symptoms in older adults who are already living with dementia, such as agitation. The irony here is quite stark. While they might be given to help calm a person experiencing memory loss, they could, in some cases, be making the underlying cognitive issues worse. Antipsychotics work by altering levels of dopamine and serotonin in the brain, chemicals involved in mood, motivation, and thought processes. While this can stabilize some extreme behaviors, it can also have a broader effect of dulling overall brain activity. The result? Often, increased sedation, a flattening of emotions, and more alarmingly, a heightened risk of rapid cognitive decline. The FDA has even issued what's called a black box warning for these drugs, particularly when used in older patients with dementia-related psychosis due to an increased risk of death. Beyond that, long-term use, even in older adults without a dementia diagnosis initially, has been linked to noticeable declines in brain function. A person might lose the ability to perform simple daily tasks they once managed easily, become more withdrawn, or find it increasingly difficult to follow a conversation. What starts as an attempt to manage behavior could insidiously accelerate the very decline it was meant to ease. It's a sobering thought, using a medication to quiet the brain, only to find it might be quieting it too much, perhaps permanently. As we age, a good night's sleep can sometimes feel like a distant dream. This brings us to number 5, Z-drugs and other prescription sleep aids. Medications like zolpidem, ezopicolone, and zaleplon fall into this category. They are prescribed to help people fall asleep and stay asleep. These Z-drugs work by slowing down brain activity, mimicking some aspects of natural sleep. However, they don't replicate the true architecture of healthy sleep. When you sleep naturally, your brain cycles through different stages, including deep sleep and REM sleep, which are vital for memory consolidation and mental restoration. Z-drugs can disrupt this delicate cycle, so even if you're asleep for 8 hours, the quality of that sleep might be compromised, leaving your brain less refreshed than it should be. Even worse, these drugs have been linked to next-day grogginess, confusion, and even unsettling episodes like sleepwalking. A study in the British Medical Journal indicated that seniors using Z-drugs have a significantly higher likelihood of developing dementia and also an increased risk of falls due to impaired alertness. Do you find yourself waking up feeling more muddled than rested? Or are you noticing that simple things, names, instructions, are harder to recall after a night on these medications? This isn't just poor sleep. It could be your brain struggling to function optimally after being pharmacologically influenced night after night. For seniors already vulnerable to memory issues, these pills might be unintentionally nudging them further down a path of cognitive impairment. Depression is a significant concern for many older adults, often arising from social isolation, ongoing health challenges, or the loss of loved ones. At number 4, we look at some older types of antidepressants, specifically tricyclic antidepressants, such as amitriptyline and doxepin. While newer antidepressants generally have a better side effect profile, these older TCAs possess strong anticholinergic properties. Remember that term from our discussion on antihistamines. They block acetylcholine, that vital brain messenger for memory and clear thinking. The aging brain is already more sensitive to shifts in neurotransmitter levels, making this class of drugs particularly concerning for seniors. What might begin as a medication to lift spirits can, over time, lead to difficulties with concentration, increased drowsiness, and a general clouding of thought. These symptoms can insidiously mimic or even worsen the very signs of dementia. Research, including a significant 2015 study in JAMA, has shown a clear link. The more anticholinergic medications, like TCAs, you take, and the longer you take them, the greater your risk of developing dementia. The troubling part is that these medications are sometimes still prescribed to older patients, even when safer alternatives might be available. So, if you or a loved one is taking a tricyclic antidepressant and experiencing increased confusion, memory lapses, or a reduced attention span? Could it be the medication itself contributing to these issues rather than just the underlying depression or aging? It's a crucial distinction to explore with a healthcare provider. An overactive bladder can be a frustrating and sometimes embarrassing issue for many seniors. This brings us to number 3. Medications prescribed to manage bladder urgency. Drugs like oxybutynin, tolterodine, and sulfasentan are commonly used to help control those sudden urges and prevent accidents. But here's that recurring theme again. Many of these bladder control medications are also potent anticholinergics. They work by relaxing the bladder muscle, but in doing so, they also block acetylcholine in the brain. And as we now know, disrupting this neurotransmitter can directly impact cognitive function. In fact, research from the University of California, San Francisco, found that older adults taking these drugs not only performed worse on memory tests, but also showed measurable brain shrinkage. Yes, a smaller brain volume in regions critical for memory, learning, and overall cognition compared to those not taking them. It's truly concerning how many seniors might be prescribed these medications for months or even years without a thorough reassessment of their potential impact on brain health. If you've noticed more disorientation, find it harder to organize your daily tasks, or just have a general feeling that your thinking isn't as sharp as it used to be, and you're on one of these bladder medications, it might be time to ask, is managing my bladder coming at too high a cost to my brain? At number 2, we have statins. These medications, such as atorvastatin, simvastatin, and rosuvastatin, are widely prescribed to seniors to lower cholesterol and reduce the risk of heart attacks and strokes. They are, for many, life-saving drugs. However, while they're working to protect your heart, could there be an unintended consequence for your brain? Cholesterol often gets a bad rap, but your brain actually needs a certain amount of it to function properly. In fact, the brain contains about 25% of the body's total cholesterol, where it's essential for building and maintaining healthy nerve cells, the very cells that transmit information. Statins work by reducing cholesterol production not just in the liver, but potentially affecting levels in the brain too. This could, theoretically, interfere with the communication between brain cells or the production of other important brain chemicals. Some individuals taking statins report experiencing what they describe as brain fog, forgetfulness, or difficulty concentrating. One review published in the journal Pharmacotherapy noted that a significant percentage of patients who reported memory issues while on statins saw an improvement when they stopped the medication. This isn't to say statins are inherently bad. Their cardiovascular benefits are undeniable for many. But if you're taking a statin and have noticed new or worsening memory problems, it's certainly a conversation worth having with your doctor. Perhaps a different type, a lower dose, or other strategies could be considered to balance heart health with brain health. Could that pill protecting your heart be inadvertently clouding your mind? And now we arrive at number 1, the category of medications that research suggests can be particularly hazardous for rapid cognitive decline in seniors: anticholinergic combination drugs. This isn't just one type of medication. It's when the anticholinergic effects of multiple drugs add up, or when a single product contains several ingredients with these properties. Think about it. Some cold and flu remedies might combine an antihistamine with other agents. Certain muscle relaxants have strong anticholinergic effects. Some gastrointestinal treatments might also fall into this category. The real danger here is the cumulative burden, the snowball effect. Each medication on its own might seem manageable, but when taken together or even one after another over time, they can dramatically lower acetylcholine levels in the brain. This can reach a tipping point where memory, learning, focus, and even basic daily functioning begin to falter significantly. One of the most compelling studies on this, tracking over 3,400 older adults for a decade, found that those with a high cumulative use of anticholinergic drugs had a substantially higher risk of dementia. That 54% figure we mentioned earlier with antihistamines often comes from this broader understanding of anticholinergic load. And chillingly, this increased risk persisted even if they had stopped taking the medications years before any dementia symptoms became apparent. It's as if these drugs can subtly, gradually poison the brain over time. The challenge is that these anticholinergic ingredients can be hidden in a wide array of products, from sleep aids to cough syrups to anti-nausea medications. It's incredibly easy for seniors who may be taking multiple medications for various conditions to be unknowingly overloading their system with these brain-altering compounds. This is why this combination effect sits at the top of our list. It's pervasive, it's often silent in its progression, and it impacts millions. Are you unknowingly caught in this anticholinergic web? Now, after discussing these potential hidden risks, I want to shift our focus to something truly empowering. Knowledge is the first step, but action is where real change happens. Research strongly suggests that what we eat can play a profound role in protecting our brain health, reducing inflammation, and even lowering the risk of cognitive decline. Let's look at 3 exceptional foods every senior should consider making a regular part of their diet. You might have heard blueberries referred to as brain berries, and for very good reason. These small, vibrant fruits are packed with antioxidants, especially compounds called anthocyanins. Think of these as your brain's personal bodyguards, helping to defend against something called oxidative stress. Oxidative stress is like rust accumulating in your brain cells over time, causing damage. Studies have shown that blueberries can actually improve memory and may even delay brain aging by as much as 2.5 years. One study from the University of Cincinnati found that older adults who regularly drank blueberry juice showed significant improvements in memory and learning abilities in just 12 weeks. They're so easy to incorporate. Toss them in a smoothie, sprinkle them on your morning cereal, or just enjoy a handful as a snack. Every bite is like adding a layer of armor to your brain. Isn't that a delicious way to protect yourself? Next up, let's talk about fatty fish. I'm referring to varieties like salmon, mackerel, sardines, and trout. These are brimming with omega-3 fatty acids, particularly one called DHA, which is a major structural component of your brain. DHA is crucial for maintaining the integrity of your brain cells, supporting communication between them, and reducing inflammation, that chronic, low-grade inflammation that can damage brain tissue over time. A meta-analysis published in the Journal of Alzheimer's Disease found that individuals who ate fish at least once a week had a 60% lower risk of developing Alzheimer's compared to those who rarely or never ate fish. And it's not just about prevention. Omega-3s may even help slow the progression of cognitive decline in people who are already experiencing mild impairment. Just aiming for 2 servings of fatty fish a week could make a significant positive difference to your long-term brain health. Imagine that, a simple dietary choice with such powerful protective benefits. And finally, let's not forget the power of leafy greens. Think spinach, kale, collard greens, and Swiss chard. These nutritional powerhouses are loaded with brain-loving nutrients like vitamin K, lutein, folate, and beta-carotene. Each of these plays a vital role in preserving cognitive function as we age, enhancing memory, and protecting brain cells. A study published in the journal Neurology reported that people who consumed 1 to 2 servings of leafy greens daily exhibited the cognitive abilities of individuals 11 years younger than their actual age. That's not just keeping your brain sharp, that's like turning back the clock on cognitive aging. Whether you blend them into a smoothie, add them to soups or stews, or enjoy them in a fresh salad, these greens are like premium fuel for a sharper, more resilient mind. How will you get your greens in today? So, what's the takeaway from all of this? If you're a senior, or if you're caring for an older loved one, this information is absolutely vital. We so often turn to medications to help us feel better, sleep better, or manage chronic conditions. But as we've seen, sometimes the very remedies we rely on could be subtly, silently, undermining our most precious organ, our brain. The most frightening part is often how quietly these problems can begin. A little bit of forgetfulness here, a missed appointment there, struggling for a word that used to come easily. These aren't always just normal signs of aging. They could be early warning signals, and it's so important to pay attention. But here's the truly good news. Knowledge gives you power. Now that you're aware of some of the medications that pose the greatest risks, and some wonderful foods that can offer protection, you can take proactive steps. What should you do? First, don't stop any medication abruptly. That can be dangerous. Instead, if any of this has resonated with you, have an open conversation with your doctor. Ask specifically about your medications, their potential side effects on cognition, and if there are safer alternatives or non-drug approaches you could explore. Second, really prioritize those brain-healthy foods. Make small, consistent changes to your diet. And third, stay curious and informed about your health. Preventing cognitive decline, or at least mitigating the risks, isn't something that happens overnight. It begins with the choices you make today. Now, I'd genuinely love to hear from you. Have you, or has someone you know, experienced memory issues that you now suspect might be linked to a medication? What brain-healthy foods have you already incorporated into your diet? Or which ones are you inspired to try after watching this? Please share your thoughts and experiences in the comments below. Your insights can help others on this journey. Thank you so much for watching. If this video has been helpful, please give it a like, share it with anyone you think might benefit, and don't forget to subscribe for more content dedicated to helping you live a vibrant, healthy life on your own terms. Here's to your brain health.